Good afternoon, everyone. My name is Minahana, and today I will be presenting on the Florida Chronic Disease Prevention Program. It is an impactful public health initiative aimed to reduce the burden of preventable care chronic diseases across the state. This presentation is going to be part of our coursework for Class 512, Organization, Delivery, and Policy in Healthcare, under the guidance of Dr. Amber Santos. The program's vision is a healthier Florida, free from preventable chronic diseases, and its mission mainly focuses on collaboration with community and clinical partners to promote a healthier lifestyles and environments targeting major conditions like heart disease, asthma, and diabetes. The Florida Chronic Disease Prevention Program emerged in response to rising lifestyle-related illnesses, surging healthcare costs, and persistent disparities in care. Rooted in both state and federal priorities, it aligns with Healthy People 2030 goals and CDC guidelines. Notably, Florida aging population, socioeconomic diversity, and lack of Medicaid expansion have intensified barriers to care. Chronic diseases are now the leading cause of death and disability in Florida. Nearly 14% of adults have diabetes, and more than 35% are obese. These conditions account for over 70% of the state's health care costs. The Florida Department of Health has implemented a multi-pronged approach ranging from public education and disease management workshops to mobile health units and free insulin distribution, partnerships with federally qualified health centers that play a key role in expanding reach. This program recognizes several key health determinants, including socioeconomic status, healthcare access, racial and ethnic disparities, Medicaid policies, and health literacy, and these factors disproportionately affect vulnerable groups such as minorities and uninsured persons. The program is evaluated using both quantitative and qualitative data. Sources include the BRFSS, hospital admission records, and community feedback. Oversight is provided by the CDC and Florida Department of Health Bureau of Chronic Disease Prevention. Positive outcomes from this program include a decline in adult smoking rates from 17% in 2015 to 14.5% in 2022. Additionally, more than 50,000 individuals have completed diabetes prevention programs with measurable improvement in A1C and the BMI values. With $16 million in annual funding from the CDC and grants, the program employs health educators, nurses, and liaisons. For every dollar spent on prevention, there is a $4 return in downstream cost savings, highlighting both its impact and sustainability. Budget oversight is handled at the state level with support from public-private partnerships like the American Heart Association. Labor is carried out by paid staff and dedicated volunteers, ensuring physical responsibility and broad community engagement. Based on feedback, the program has revised its strategies to increase rural outreach, translate materials into more languages, partner with more schools, and expand to include hypertension management in the recent years. Public awareness is spread through statewide multimedia campaigns, workshops at community centers, and printed materials. County health departments integrate these in health fairs and diabetes days to reach wider audience. Positive unintended effects include the rise of community collisions and increase in volunteerism. However, challenges remain, particularly with rural engagement and program follow-up, prompting further intervention. The program adheres to CDC best practices and submits annual evaluations. Due to its integration within the state's public health infrastructure, no additional accreditation is required. The next goal is to reduce ER admissions for diabetes complications by 10% in high-risk zip codes. Targeted interventions will be tracked using discharge data to measure success. Using the Milstead's policy framework, effectiveness in regards to the effectiveness of the program has lowered smoking rates and improved diabetes outcomes. In terms of efficiency, it demonstrates cost savings and high return on investment. In terms of equity, it serves underserved groups, promoting health equity. In terms of political feasibility, the program aligns with bipartisan health priorities. Continuing for the program evaluation, so for the administrative feasibility, the program is smoothly implemented through existing public health structures. For social accessibility, community feedback, and culturally tailored materials promote acceptance. And in terms of costs and benefits, funding is stable with proven outcomes. And unintended effects, positive collisions, and rural outreach gaps are being addressed. Currently, this is like an area of weakness for the program. To summarize, the Florida Chronic Disease Prevention Program stands out for its effectiveness, equity focus, and sustainability. It offers a model for other states looking to reduce chronic disease burden while engaging underserved communities. Thank you so much for taking the time of your day to watch my presentation. Here are the references I used for this presentation, and please let me know if you do have any questions. Post them in the reply or comment in the discussion board. Thank you.